Brett.
Hi.
Welcome to HealthTech with Purpose.
Thank you for having me.
Great. We're glad to have you here. Before we start, so how are you finding Nashville and, how things?
I just asked my team what day it was, so it's been a long couple of days, but exciting. I think Vibe is one of my favorite conferences. Out of all that I attended last year, it was one of the most memorable, and this one is definitely doing that as well. So
Awesome.
Yeah.
Awesome. So, we'd like to know a little bit more about you, about your journey till this point.
Yeah, so I've been in a sales or marketing go-to-market type role almost 13 years now. So I worked for big companies, Cerner and Optum being kind of the two big ones. And then I've also worked in the ACO space with HealthTech Health prior to the Signify acquisition. And then most recently was working for a point-of-care ultrasound company called Butterfly Network, and recently took, after doing a lot of consulting last year, I recently took the role of Chief Growth Officer for Heartbeat Health, which I'm week 8 into right now. So very fresh.
Nice.
Yeah.
So, tell us more about Heartbeat Health, what you guys are into, what's the product about?
Yeah, so it's exciting. A little personal history. My grandfather has stage 4 CHF. So I've been a part of his support and care team for my entire life. And when I met with the Heartbeat team, they are tech-enabled cardiology services. They kind of have two kind of pillars of their business. One is the actual clinical services. We have the largest virtual cardiology provider group in the country, covering all 50 states. And then we also have tech that is part of that platform, which is really our, think of it as our digital hub, where a clinician can be in the state of Washington, log into their hub, and they can be either reading some diagnostics like EKGs and doing those interpretations, or they can be doing a visit with a patient in Florida. So it's really difficult to see a cardiologist and get in due to staffing shortages, and if you're living in a rural area. So Heartbeat is helping to address that by making access to cardiology much more seamless and easier for patients to get the specialists that they need.
Interesting. So, what's the impact that you see and that you wish to kind of bring in, and where are you in that journey?
Yeah, well, I've always obviously had a passion for CHF because it is a manageable disease if you are educated and know. And a very simple story that I like to tell is if you're in congestive heart failure, even the slightest bit of weight gain overnight typically means that there's fluid collection around your heart, and that can be a sign that you need to be seen by your cardiologist immediately to get diuretics. What's interesting is we got my grandfather a Withing scale during my Cerner days, which was almost a decade ago, and it was connected to his Cerner health record, which I set up for him, which would send me a text message on my old Razor phone that his weight went up, and so we could intervene and say, "Hey, Pappy, I saw that your weight went up. We're going to get you in to see your cardiologist." But a lot of patients don't have that, support system. And what's interesting is, of course, Heartbeat, it does partner with Withings to do some of that now. So it's exciting that we were doing that, but now we're trying to do it at full scale. But in addition to that, there's a lot of other cardiovascular conditions that we see, and a lot of, at least what I'm hearing at the conference, which has been interesting, is because of the staffing shortages or cardiologists are retiring, there's a need for specialty cardiology like oncology cardiology, pediatric, and a lot of these hospitals just don't have the resources to hire that person, or they can't find anybody that wants to live in that area. And so being able to access our large team of cardiologists and still provide those services that are high acuity needs, that's been incredible to see that come to fruition. But my job as Chief Growth Officer is to really streamline what we're selling into the market and make sure that we're focusing on the right segments, the right buyers, and what can add the most value in terms of patient outcomes, but also, obviously generate revenue, being that we are a business that needs to make money.
Yeah. So, on that note, walk us through, how somebody gets onboarded, both on the provider side as well as from a patient perspective, that how, a patient can use the technology and how provider benefits from it.
So there's two paths. So if we're working, let's say, with a primary care provider, which we do a lot of work in that space, typically the referral comes from the PCP or the primary care provider to us. And, typically it's they've done some sort of recent diagnostic testing. We've done the interpretation on it and have, seen that patient has a certain condition. The primary care physician then refers them to Heartbeat, and that's when they engage with our cardiologist and we call them our heart heroes, which are doing a lot of care coordination. That's kind of one referral path. For Medicare Advantage plans, typically they send us an eligibility file based on a certain set of ICD-10 codes. So it kind of helps us to trigger patients that we could essentially help with. And the goal really there is to keep those patients out of the hospital, especially if they don't need to be in the hospital. We all know that the default is always to go into the ER, and sometimes those end up being very expensive visits and can be prevented with the right patient education, the right medication titration. So that's one avenue. And then the third would probably be, which we've been having a lot more discussions at this conference, would be the cardiologist actually could refer patients to us if they want to focus more on high acuity in-person visits and give us some of the services that they don't necessarily have time for, capacity for, and or don't have the specialty knowledge. And so we're doing a lot of peer-to-peer e-consults, or they're referring their patients to us. In terms of what the patient sees, we work with a lot of remote patient monitoring device companies. Some are strategic in nature, some are just more a need based on the client. And so they can either have that device connected to our platform for more automatic results coming in. However, for the older population, sometimes setting that connectivity up can be difficult. So they have like a basic, blood pressure cuff, and they can actually manually log their stats or their data into the platform. And we find that for the older population, that seems to be where they are better engaged if they're actually entering it in themselves. Because if they can't get the tech to work, then they give up and then they don't want to report the data. So we really are cautious about how we approach every single partnership to ensure that we're working with the patients based on what their level of acuity is, what their tech knowledge is, and making sure our heart heroes are engaging with those patients to make sure that they're actually, following our protocol and happy with the services that we're providing them.
Nice. So on the patient side of things, right? There's a lot being talked about privacy, data, the whole HIPAA compliance. So, and one of the things that's been discussed is how you can bring up that transparency and at the same time increase the confidence of the patient that their data is safe. So how does Heartbeat kind of handle that?
We had a really interesting conversation with a vendor yesterday about this, actually. Well, they obviously have to agree to the consent, and that consent form has to be provided to them with some context. So a lot of people, if they get, like let's say remote patient monitoring, they know what they're getting, but what they have to understand is what is the outcome going to be if they give us the data. A good analogy that was shared yesterday was, we all use maps like Google Maps or whatever your preference is Waze. And when you're opening that app, you're, giving, access to your data, right? But you know what you're using it for. But that doesn't necessarily mean that you want Google Apps or Google Maps to have access to all of your data. So I think you have to structure the consent in a way that the patient knows exactly what the data is being used for and what they're going to get out of the program from the clinician. Otherwise, they're going to question everything that's in there and why do you need this data, why do you need that data? But if they understand what the program is, it's much more of a check off the box for them to go through the process, and then they go through, sign it, and move on.
Nice.
Yeah.
Nice. So, how do you plan to scale up? Is it, geography-wise? As a chief growth officer, I think that's one of the primary things that you also might be looking at. Or are you adding certain more features to the app? So, what's the plan?
So I think I see a lot of startups suffer from this. I don't know if I would call Heartbeat a startup. They've been around since 2017. and we're a very mature Series B organization, but I see a lot of organizations that I call it shiny squirrel syndrome, where they get an incoming lead or whatever, and they're doing a lot of custom work for a lot of different clients. And it's really important to make sure that there's like some streamlined focus on, okay, what are we selling in the hospital market? It can't just be everything custom, right? You have to really think about what is the market asking for right now? What can we deliver today versus potentially next year because of roadmap, dependencies. And then have like very specific buckets of this is what we sell in this market, this is what we sell in this market. So I'm doing a lot of that analysis right now in my role because Heartbeat has so many incredible partnerships, but they're very, very broad in terms of what we're offering. And I want to be cognizant that we don't run our engineering teams out, we don't run our heart heroes and some of our ops team because every single thing that we're doing is custom every time. So creating more repeatability in our process, including very like basic tactical things like getting a CRM that is going to be provide us more visibility into opportunities versus I know it's easy to do like really bolt-on solutions, but you have to have kind of a central like source of truth that everybody's working from. And so I'm going through that CRM diligence right now. But it's for me where we scale is going to be streamlining exactly what we're selling in each market and then hiring the right salespeople or leveraging our existing sales team because we already have some incredible assets there and making sure that we're focusing them in the right direction with the right set of sales enablement tools to go, get us the revenue that we need. Yeah.
Awesome. So, if you could share any interesting success story or something that lifted everybody's mood, because you're trying to build tech, you have already built a company which is doing good. Mm-hmm. So would be interesting for for everybody to listen to that.
Regarding Heartbeat,
yeah.
I think it's interesting because before I came on board, we weren't doing a lot of work or even really selling into health systems. We were focused on provider groups and Medicare Advantage plans, and we participated in the hosted buyer program, and almost all the requests came from health systems. And I love that because I've been saying that from day one, and this validated that assumption that I had. And I think that, our business model could potentially look as, that we're a threat to cardiology groups that are, owned or affiliated by health systems. But what we found in the last, 2 days in these conversations is we're not a threat. If anything, we're an extension, or we can help close care gaps that your cardiologists aren't able to get to because they're burned out, they're at capacity. And so we provide the, enablement for those cardiologists to do in-person higher acuity RVU type visits. And we can help, for a perfect example would be patients in the hospital, they get released. If that health system is in a risk, at risk and participating in some sort of risk model, we can do that post-discharge visit and make sure the patient understands their medication adherence, they understand what they were diagnosed with and all of that follow-up, and then route them back to their cardiologist. So we're not necessarily taking business away from the health system, but making sure that patient doesn't have a readmit and we're still keeping them in kind of the healthcare ecosystem and sending them back to their cardiologist. And that to me is exciting that health systems are leaning into that model. So that just for me, I feel like we opened up a whole new channel for us to go after this year, and I love that space. So I think we can make incredible impact there.
Awesome. Yeah, I mean, as you rightly said, with a good number of talent gap in terms of doctors, cardiologists, and in fact I talked to a couple of people yesterday where in fact getting good nurses is also a challenge, right?
Yeah.
I think this is solving a major gap there because when you collaborate, I think there's a lot to do.
Yes, I have spoken with a lot of cardiologists that retired during COVID. They were close to retirement, but going through that, I think they were just like, I have to walk away. Not to mention, I think that changed really the landscape of what was important to health systems, in just the way how they spend money and who they partner with. So there's a high, and I don't have the stats off the top of my head, but cardiology is one of the highest groups right now that is seeing a decrease due to those physicians retiring early. which is making it really difficult for patients with chronic conditions to be regularly seen by a cardiologist. They're having to wait, 3 to 6 months to get in with that specialist. So I think it's important for cardiovascular diseases for those patients to have access to that care and to be educated on what it is they need to do for themselves to manage their condition. And right now, that's a huge problem. I mean, CHF and hypertension are one of the highest cost diseases in the U.S. and a lot of them not necessarily can be we can't, once you have it, it's there, but we can help it, get worse, and we can help with prevention as well.
Great. So, finally, coming to the $1 million question, right? So what's the purpose and where do you see Heartbeat going?
Oh gosh. I think for me, the purpose, having a grandfather that was a routine person in and out of the ER, for me, educating patients for prevention on how to mitigate, getting these cardiovascular diseases is really, really important to us. But really helping patients get care from the comfort of their home and keeping their support systems in the loop. I think that's really important. And when I think of rural communities or even urban communities where patients don't have access to transportation, you start to think about like that social determinants of health that everyone is speaking about. That's to me where we make the biggest impact is, getting access to a cardiologist is difficult enough, but making sure that they understand why they need to see a cardiologist and doing it from the comfort of their home. I see that's going to be a big pivot in the digital health community and not just for cardiovascular. I see that for patients with COPD, diabetes, etc. That's going to help lower that cost curve and improve patient outcomes going forward.
Amazing.
Yeah.
So Brett, it was nice talking to you.
Thank you.
Thank you for being here and thanks for joining us today.
Absolutely. Thanks for having me. This was fun.
Awesome. So just waving to everybody that who will be looking at us.
Okay.
I hope you guys got to learn a little more about Heartbeat and what impact they're bringing.
Absolutely. Thank you.
Awesome. Thank you.